employment, unemployment, etc. So basically, what many studies like listed here find that elevated income levels basically improve mental health outcomes, basically by reducing the level of, say, anxiety or depression. And Paul and Moser, note this Paul is not my co-author, he's some other Paul. Okay, so find that unemployment increases mental health, especially for blue-collar workers, and it's more pronounced in countries which have weaker unemployment systems, like for example, countries like in the Scandinavia and some of the Western Europe countries, they have a strong employment protection, whereas many other countries in developing countries, they have weak unemployment protection, and these countries, basically the negative effects is even more prominent. So further studies have investigated the influence on income inequality.
Point this way, maybe.
Okay. Stuck.
The arrow, the right arrow. This? No, yeah, the right one.
Yeah.
Start.
It looks okay. Majority of the studies indicate that more equal societies have better health and longevity. But there are some studies which find either no relation or opposite relation. In the case of Australia, Bechel et al., they find that income inequality has only minor effect on mental health, right? So basically, many studies have looked at the impact of labor market outcomes on mental health. But in this, there are very few studies which look the other way around, the reversing the causality from mental health to income or labor market outcomes like unemployment, like work hours, etc. So, for example, writers investigate this relationship using ILDA data. So this paper also uses Australian ILDA data. So they find that poor mental health is linked to reduced working hours and lower income. And also the impact also varies from by age, with younger individuals more likely to be unemployed due to poor mental health, and older ones basically work fewer hours. And also similar differences exist based on gender also, with poor mental health associated with lower employment for males and reduced work hours for females, right? So, and again, recently, Bubonia et al., they explored the impact of mental health on two workplace productivity metrics. One is absenteeism, which is basically being absent from work, and second is the presenteeism, which is basically while you're working, you're not as productive as one should be. So their findings suggest that individuals reporting poor mental health experience high rates of absenteeism, and they also show reduced productivity at work. With the income as a dependent variable, there's only one study in 2008 by Liu et al. They analyzed the longitudinal household data from China, which reveals that household income significantly is affected by the health status, especially in rural areas. Again, it's general health. It is not in this paper, it is not mental health, it is general health. So the motivation of this work is basically, it has a dual purpose. One is looking at the effect of mental health on income, and then also on income inequality. So, so understanding the impact of mental health on income is challenging because of many reasons. One is bidirectional causality, because mental health can affect income as well as the other way around. And also you have unobservable factors, and also survey errors, because many of the variables in the regression are basically survey-based, survey-generated variables. So again, survey, you have response and other errors, right? Measurement errors associated with survey, right? So to address this, so we employ instrumental variable fixed effects estimation using panel data from the first 19 waves of ILDA survey. Why 19? Because we didn't want to bring in the COVID effects. So we want to see from 2001 to 2019. And again, the good thing is that this is repeated cross-section. The same amount of people are tracked over time. So 19, and again, so one can account for fixed effects also because it's a panel data. So, and so basically, we estimate a regression, and the regression, the dependent variable is income or disposable income. And then the variables on the right-hand side are independent variables, basically, which basically can be treated as income flows. So there will be income flows for, say, one of the important variables is the mental health. So there will be income flows from mental health. There will be income flows from other variables as well. So these income flows are estimated, and then we compute a generalized entropy inequality measures decomposed by income flows. This adhering to Paul's negativity property. Negativity property means that when you have income, right? So many times your income may have different components. For example, a simple thing is income can have business income, you could have salary, etc., etc. Now, so these are different sources of the income. So the negativity property means any source, any particular source, say for example, business income. If you add everybody's business income in the population or in the distribution by the same amount, the inequality should reduce. So, so many measures, this extra constant addition, the total inequality does not reduce. It is either zero or it's probably sometimes positive also. Gini, the total it gives you negative, but in the case of Gini, you cannot pinpoint which source is responsible for the decrease in inequality. So that is why we need this negativity property, and which there are only few indices has. So we'll see that in this paper. So we employ one of those indices. So basically, this inequality decomposition is an ex post exercise. It's just an accounting exercise, right? So it just tells that the overall inequality, how much does different components like mental health, how much it contributes, other factors, how much it contributes, right? But the important thing is that this is just a decomposition. It's just an ex post exercise after you estimate regression. But from the policy perspective, you can only improve mental health at the margin, right? You can't drastically improve. So important thing is that it is important to find that if you improve by a policy change, if you improve mental health of the population under studies by some small amount, how does it impact the overall inequality? So basically, we get the elasticity of income inequality with respect to a marginal increase in mental health, because that's important in policy. Because in policy, you can do only you can make changes only at the margins. So we replicate this analysis for males and females to see how the effects are different for males and females. So basically, this is just fixed effects regression model.
Just one clarification, because you're going to use the same data. You want to say a few words on, like you mentioned, there were a few papers that looked at the effect of mental health on income or absenteeism. And how do they get around? What is their strategy for getting around both these reverse causality or endogeneity problem?
So they used, like for example, so they have also used the Freitas paper also use IV fixed effects, right? But some of the Freitas 2014 paper also use some of the measures are binary, so they used IV probit. So in our case, the dependent variable is income. So they also use instrumental variables to tackle the endogeneity problem, right? So only thing is that they use some instrument, we use a different instrument.
What are these instruments?
Yeah,
I will talk about it. It's coming, right? Yeah. Yeah.
And also, I have another clarification question. Can you just talk a little bit about how you are measuring mental health?
Yeah, it'll all come.
All come.
So here the important parameter of interest is delta. So delta tells you that how a one unit increase in mental health, how much income changes. So we anticipate delta to be positive, indicating that improvement in mental health improves individual's productivity and consequently increases income. And here, so here we are the measure which I'll construct for mental health. Here it is the higher the better. Right? One can construct the negative. If you construct the inward, it will be negative. In this case, the way we construct is the higher the better. So if it is 0, it's the worst mental health. If it is the highest, it's the best mental health. So alpha is basically individual specific fixed effects, capturing all the time invariant factors. Like this could include history of mental health issues and individual traits such as cognitive ability. And literature has shown that they have positively correlated. These are positively correlated with both mental health and individual.
But if it's a repeated cross section, how are you going to have individual fixed effects in it?
Yeah, right.
It means it's the same individual, right? It's a panel data, isn't it? So it's
not a cross. It's a panel data.
It's panel data.
It is panel because before you said that it's a repeated cross section.
Yeah, repeated cross section can also be panel if the people are the same, right? People. So it's the same people you track over time. Right? So,
yeah, that's what I'm asking. Is it a repeat? No, it's not a repeated cross section. It is a real panel.
It's a panel data.
Yeah.
It's a panel. Yeah.
Individual traits like cognitive ability to be time invariant. Yes. So if you have a fixed effects, individual fixed effect regression, the cognitive ability variable should wash out, right?
Yes, it will. Yes, it will. Yes.
So there's like, if you're running a fixed effect regression, any invariant individual variables such as cognitive ability, you can even take it out of the model.
Yeah, it will be eventually when we estimate it will come out. Right? Correct. Okay. So reliable estimation delta in the whole equation hinges on the requires mental health to be exogenous, which probably is not a valid assumption. So and because of many factors which I already mentioned, also measurement error in survey and also in the variables. While our mental health measure originates from a widely utilized survey, INDA survey is widely used, but it may still serve as a noisy proxy for underlying mental health if survey responses are influenced by variation interpretation, social desirability. So again, survey responses, of course, there's a lot of subjectivity in that. There's not a lot of it. So there's going to be measurement error, right? So another possible source of measurement error comes from time disparity of the variables, two variables, dependent and independent variable. So while income pertains to past year at the time of interview, mental health question utilized refers to the last 4 weeks. Again, so this is again, this also could lead to measurement error. So if these measurement errors are classical, our IB approach can address them, right? So in the case of fixed effect, you also will have attenuation bias. So attenuation bias in the sense that your coefficient of interest delta will be biased towards 0, right? So I'm not going to go into this thing. These things are well documented in these references, right? So the high probability of endogeneity and attenuation biases drive our adoption of instrumental variable fixed effects estimation approach. So the first stage is we regress mental health on a set of on a phi I. Yeah.
Sorry to interrupt. On this question, if the measurement error is classical, do we have any prior on whether it's classical? Because in my mind, like if I'm the type who underreports or overreports in survey,
Yes.
I'm likely to underreport or overreport both mental health and income. Right? It's very unlikely that
That is true.
I'm happy and I'm not making money.
That is true, but overall, if there are positive and negatives, if they cancel out, it doesn't matter. But if everybody does the same thing, it could be a problem.
But then you might end up in a situation where you have non-classical measurement error.
It is possible. Here, I'm assuming a classical, right? And I also do some tests, right? So, okay. But you're right. If it is not classical, there's going to be
an instrumental variable
yes.
is not going to fix that.
Yes. Okay. Okay. So again, so ZIP, basically we take two instruments. One is the physical functioning, and second is the social support. I define what physical functioning means, what social support means, and then the vector of control variables XIT, which comprises time-varying exogenous determinants of real disposable income. And again, this income is at constant prices, so constant 2019 prices, right? So again, the identification of delta in the first equation, that is the income equation, is shaped by the changes in income of individuals whose mental health is impacted by both their physical functioning and social support they receive from others. So description of data. So we, okay, again, right, so the data here is the data from the same ILDA data. So it's the household data. For 19 years, and we're looking at individuals 19 years and above. So mental health is assessed using responses to 5 questions concerning the frequency of anxiety and mood disturbance symptoms experienced in the 4 weeks preceding the interview. So each item is rated on a 6-point scale, and the scores are summed and rescaled to a range between 0 and 100. A score of 0 indicates poorest mental health, and 100 indicates the best. And other people have used it, like Bechdel et al., Bugunia et al., they've used it. But some of them have used constructed this 0 to 100, and they have defined that about 65 and above is good mental health, and below 65, poor mental health. I have not constructed a binary. I have kept as a continuous variable.
Yeah. One more question on the instrumental variables, right? So if you were to get over the sort of reverse causality issue, you need the instrumental variable to justify the sort of the first stage and the exclusion. Right?
Yes. So I do the tests. I do the under-identification test, over-identification test, Hausmann's endogeneity test. It all passes. Now all that passes. That does not mean there is no problem. So I take care of all those things.
Yeah.
So I don't have an issue. So it looks like they are valid. They can be used as instruments.
Any comment on like physical function? Right?
Yeah. Yes. Yeah, physical.
It matters for income.
Yeah, it could
from mental health.
You know? It could matter. But interestingly, physical functioning in the literature, people have seen that physical functioning could make you more productive, or even there's no like correlation, the one-sided correlation. If you probably are disabled, you probably are going to work more than going anywhere else, right? So again, these instruments, there's some justification, and some justification already people have used in the literature, because finding an instrument by a new instrument is going to be always controversial. So the instrument which I picked, people in the health literature have already used it for mental health previously. So I will come to that. Yes.
Yeah, I mean, I guess you will come to it, but this is exactly, I mean, even if you think about social support, right? Social support are also useful for, we talk about why networks are important, to find jobs, to link me up with better jobs. These are all, conceptually, they're all violating the exclusion restriction directly for us, right? How do we, no matter what the test says, conceptually, I'm finding it hard to convince myself that they meet the exclusion restriction.
Miss, I don't disagree with that, but the point is that one of the reasons why we used it is the availability of data. The second thing is that in the literature, many people have used these two, right? And these two in the health literature are consistently used. But I take your criticism, right? I'm not denying it, right? Because instrument is always is a instrumental variables to justify in any case is going to be difficult. The fighters used an instrument which is very controversial, but I'm not going to go into that, but you can read the paper. It's in Health Economics 2015. Anyway, this slides at the end, all the papers are referred, so you can look at it. So according to human capital theory, so there is a so we model instead of, so in the age, we model as a hump-shaped relationship. Usually in the literature, people have age and age square. So which gives you a symmetric quadratic, but actually in the literature, people have found that a hump shape is much better. So we model a hump shape relationship, right? And again, graduate, city, professional, white collar, these are all binary variables. And also for marital status, married, de facto, and separated or diverse, they are binary variables. Singles is the default group. For the occupation, the default group is manager. So again, okay, so we contend that physical functioning and social support received by individuals meet this criteria, as extensive literature has demonstrated, their substantial influence on mental health. So you can look at this paper. So while other instruments for mental health exist, we choose to focus on these two and validate them through statistical tests. Now, it is definitely like if we were able to find some variable from the HILDA data, we would have used it. So given the literature, and again, there is criticism also, right? So as what Rajesh mentioned, but given the data which we are dealing with, we use these two variables because the literature extensively uses them. So social support measure is based on transform scores for 10 items that describe the amount of support received from other people. The self-completion questionnaire in HILDA obtains from respondents the extent of agreement on a 7-point scale, with 1 being the least, which is strongly disagree, and 7 strongly agree, with 10 statements about how much support they receive from others. So statements like people do not come to visit me as often as I would like. I often need help from other people, etc. And then there is someone who can always cheer me up when I'm down, etc. So these are 10. So if you see the scales for 1, 2, 4, and 5, and 7 are inverted because we want to make sure the higher is better mental health, right? So that the higher score will correspond to greater social support. Sorry, in this case, social support, greater social support for every item. Thus, the maximum score is 70 because 7 is maximum. There are 10 questions, so 10 into 7 is 70, and minimum is 10 because minimum score is 1. So then they are converted to range 0 to 1 by maximum approach. And then the physical health variable is constructed as follows. So here again, SF30 short form 36 health survey, which is very common. So this is also in HILDA. So respondents are asked to indicate whether they are limited a lot, limited a little, or not limited at all in each of the 10 activities, like vigorous activities such as running, lifting heavy objects, right? Participating in stress sports, etc. Walking, 8 is walking half a kilometer. So these basically tells like how much physical functioning an individual has. The responses are transferred to a combined score that ranges from 0 to 100. The higher score corresponds to better physical function, right? So again, so let's look at some of the statistics here. So here, I think this. Okay. So I think this I will have to zoom in. Is it okay?
Yeah. I think you haven't addressed what mental health is yet.
Okay, I think I have to probably go to before. Yeah, so this one, right? So basically, if you see the mean disposable income increases over time. Now, if you see mental health is deteriorating, average mental health is deteriorating over time. So keep in mind, this fact will be used later on. So the mean age is increasing from 39.87 to 41.50. The graduates also have increased. So the managers are steady professional percentage has increased. The group is.
I'm confused. If it's a panel data,
Yes.
Yeah.
the mean age should be increasing much faster, right?
So this is
If it's the same people.
So, but this is 5 years gap.
Right, but then like,
Yeah, but there are people coming out, so there is
it's a rotating panel.
of course, right? So there is some attrition. Of course, right? There are people going out, there are new people coming in, right? So on average, yes, the average is increasing, but there are people going out and coming in.
So just to be sure, so this data set is smart panels, it's a repeated cross section.
No, it's a panel. It's like this, right?
People are followed.
Yeah. So, for example, I am there for 10 years. Right? Then I'm gone. You enter in the 9th year. So you will probably exit in the 15th year. But there may be people who will be all the 90 years, right? So again, I can only estimate individuals who have at least 2 observations, right?
Oh, yeah.
Right. So at least 2 observations. So those who are not in the 2 observations, they will drop out of the panel, right? So okay. So these are okay. Another important, this also I would like to point out, you keep in mind. So people less than 25 mental health now increases from initial year 1.53 to 18.77%. And people who have very high mental health, which was 57, average 57 in 2001, it goes down to 45.499. So here what's happening is, so the distribution of mental health is getting worsened over time. So this fact, please keep in mind. Okay, so that's important. So people who are mental health are very bad, the percentage increased. People whose mental health is very good, their average has decreased over time. So basically, the distribution of mental health has deteriorated over time, right?
And this is this is globally true, or this is only the case for Australia?
Australia. No, globally I can't say. I can.
You don't know.
I don't know. So again, mental health again is also mean mental health also has. Yes.
So the measure for mental health is all self-reported. There is no any objective measure of how, if I have any mental health issue or not. It's just you ask me how do you feel, how happy you are, and I report.
Yes.
Okay.
Of course, that as
because what I'm thinking is that these kind of questions and answers are also like kind of a mindset, like
yes, I agree with that.
This day of the week you got me.
That's true. All this.
But the mindset is also very related with your income.
Yeah. So that's what I also mentioned, right somewhere. Yes. Right. So origin of widely utilized maybe if mental health survey response are influenced by variation in and social desire. So these are there. Right. So we can only do. So of course there are problems with that. Right.
And you ask me on a Sunday.
Yeah. Economists.
You look at the aggregate figures and you say mental health. For me, they look like pretty constant.
No, that is a mean, but I've also shown the distribution, right?
So the young are getting happier, the old are getting.
No. So I'll control for that. But what I have shown also in the distribution of work, the people who have mental health less than 25, right?
That's not age.
Yeah. So that basically has increased from 1.5 to 18%. People who report very good mental health, 75 to 100, they have declined from 57 to 45. Yeah. Right? So the distribution also, mean has declined, but distribution also has declined.
But the mean decline seems to be very small compared to these huge changes, right? The distribution seems to suggest.
Yeah, because new people are coming or going, right? So that is the artifact of the data, right?
And new people have TikTok.
From the house.
Can you speak more about like what is this mental health like? Is it like more of a perception about happiness, or is it more about what specific mental health are we talking about? Is it depression, anxiety?
So that's what, right? So this is the question. So again, I have to go to the questionnaire. So it is basically it takes into account your like anxiety levels and so here.
Isn't it social?
So it's anxiety and mood disturbance symptoms. So it's more mental, right? Anxiety and mood difference is something to do with mental. So exact questions I have to look at the survey questions.
Anxiety.
So it's about anxiety and mood disturbance. Okay, right? But it's subjective. Right? It's definitely subjective.
Yeah, because I was also thinking about like, the severity of mental health, and that might also have different implications when if we're talking about depression versus anxiety versus panic attacks and whatnot, different kinds of.
Yes, I think there is some depression variables also in HILDA, but they don't have for 19 years.
Okay.
They have only a few years. Some people have used, but their methodology is different.
Yeah, but 80.
But I used, we wanted to do mostly mental health. So this is also a proxy for mental health. Okay, so the proportion of, so these things I already mentioned. So professionals have increased, whereas blue collars have decreased. So, so again, the average age of individual in the sample rose slightly over years. Okay, this suggests some attrition in the data set, right? With new response being interviewed each year, right? While sample attrition and non-response rates are common in large panel surveys, the re-interview rate of previous wave respondents in HILDA survey has remained high, ranging from 87% in wave 2 to 96% in wave 9, and thereafter remaining at almost similar levels. These rates compare favorably with those achieved in other panel surveys, which are more known are the German socioeconomic panel and the British household panel for the first 11 waves. So again, this is not what the HILDA is not very different. Probably they are if you compare it, it's more favorable compared to these two main panels. But again, a lot of people in Europe, they use this. But since I had access to Australian data, so I used Australian data. Okay. So table 2 will display the regression results. I'll come to that. So basically, the coefficient of mental health is basically, okay, so I'll show you. Okay, so let me show here. Yeah, so clearly when I do fixed effect, right? So this is basically, this is not significant and this is very low because fixed effect only takes for the unobserved alpha I, unobserved heterogeneity or the fixed effect. Whereas here, basically, it tackles the endogeneity issue because fixed effect does not tackle because there's no instrumentation here, right? All the other things are very similar, right? So if you see the so most of the control variables and mental health variable are statistically significant at 1% level, and also I have done the Houseman test. And Houseman test does indicate that mental health is endogenous. And I have also done all the tests for over-identification and under-identification. And I think as far as statistically, they work fine.
But can you give us some intuition as to why we expect an IV estimate to be 10 times the size of your fixed effect estimates? What's driving us?
And it's not statistically significant also. And it's mostly from what I see, it is because the fixed effect, it doesn't account for the endogeneity, right? The measurement error, reverse causality. So
yeah, but I'm asking you why is it resulting? What is the factors that are leading to a downward bias according to you when you don't account for endogeneity, such that when you account for it, leaving aside our questions about the instrument as to why should it be 10 times in size? That's an incredibly different result. No?
I would say similar, not means I don't know the exact reason, but it was very similar in the case of Freitag as well, but Freitag had different variable. But Freitag also, when he used the fixed effect, I think that magnitude also probably, I don't remember, but it was also significantly different so from what I understand from a very individual, taking a different outside view of it, I think from me, it is the endogeneity, but specifically like endogeneity due to measurement error, endogeneity due to reverse causality, all this different, I'm not able to disentangle. But I'm reporting that because that's one thing which tells you definitely the results are quite drastically different. But as you would have seen that other, like the occupation, all the coefficients are very similar, right? So what is actually happening is, I think mostly it is because it is not tackling endogeneity, but not due to which one I don't know. Whether it is because of measurement error or reverse causality or unobserved factors, I don't know.
But measurement error is not endogeneity, right?
No, but measurement error could lead to endogeneity, because endogeneity could be due to reverse causality, it could be due to measurement error, it could also be due to omitted variable, right? So the endogeneity could be due to many factors. Even if I use a lagged variable also could technically be endogenous, in the sense that the lagged variable may be correlated with the error term.
Without a doubt, I would
right.
say,
right. So I don't know the reason, right? But I'm just presenting what actually the difference is significant, right? But if you see the coefficients on all the other variables, they are very similar, right? And I think disentangling the effect probably may not be that easy. So Houseman test indicates that the mental health is endogenous variable. So all the coefficients are statistically significant at 1% level in the specification, the IV fixed effect specification. This suggests that for the mental health variable, a 1-point improvement in mental health leads to an increase in $128.12 Australian dollars increase in income. So this is the productivity effect of mental health. And in other words, if an individual goes from totally mentally unhealthy to totally mentally healthy, we can say that other things being remaining the constant, the person who is mentally more healthy earns around $12,800 more than an individual who is mentally most unhealthy. So this is a significant, like if you assume these regressions are fine, right? So this is 12,000 is a significant, right? From going from 1 to 10. Or 0 to 10, it's significant like improvement in income. So coefficient of V1 and V2 are positive. V1 is positive and V2 is negative. So this is also telling that you have a hump-shaped relationship. And again, and the peak happens at the age of 67. So income increases up to on average 67, and 67 is the peak, and then it comes down. So university degree holders earn 12,500 more than those who do not have a university degree. Those who live in big cities earn about 3,500 more than those who live in smaller cities. So big cities versus smaller cities. So again,
there's an interesting number there, right? Like if you believe the estimates,
yes,
you were saying improving mental health from 0 to 100 has the same impact on income as going and getting a university degree. Mm-hmm. So just to note that those coefficients are similar. If you believe the estimate.
True. Yeah.
Do you have a similar benchmark for like other physical health correlation with, or implications of like health on productivity as well? And how does this compare to physical health?
No, I have not done, because physical health and social support are in the first stage, and they are correlated with mental health.
No, I mean like in other literature, in existing literature.
In existing literature, I don't know, and nobody has seen the physical health and income. People have used like physical health and some other like labor market outcome like unemployment, other things, but I don't see anybody doing income. Okay. So this is, I think, the second study where the dependent variable is income.
That's right.
Okay, so there are also significant differences between occupations, with managers at the top and blue collars at the bottom. So compared to singles, marriage and de facto and separate divorce earn more. So the income of separated divorced individual is much higher than the married individuals. Again, these things will slightly change when I do based on gender. Right, so let's come to the decomposition, right? So decomposition of income inequality by regression decomposition, regression-based income flows. So if you see, once I estimate the regression, right, the first equation. So I have dependent variable income, and then I have the fixed effect alpha I. So that alpha I is a flow. That's the income flow. So which is time invariant, and then m beta 1 times mental health is the income flow coming from mental health. So all the occupation coefficient with multiplied by occupation is the is basically flow from occupation. Similarly, you have flow from your geographical regional factors. So these are all flows because the dependent variable is in dollar or real dollars. So the independent variable, each term also on the right hand side also should have the same unit. But they are some is like fixed effect income flow, then your mental health income flow and other remaining income flows. But our focus here will be income flow, that is the beta of coefficient or delta coefficient of mental health times mental health, and because delta is constant, delta times that is the flow due to mental health. The flow, that is the contribution of mental health income to the total income, right? So any inequality measure that can be expressed as weighted combination of income is amenable to composition by income stream. So here, this yi is the income dependent variable, and this is the weight given, and this weight will differ based on what measure, what index you use, what index of inequality you use. So here y is the distribution. So we can look at y is for say 2001. So y will be all the individuals in 2001. So suppose there are 10,000 individuals in 2001. So y1, y2, y3, 4, y4. That is the income. So that's the distribution. I is basically the inequality measure, and wi is the weight for that income. Now, YKI denotes the income generated by integration variable K. So basically here, K equal to 1 will be the fixed effect alpha I, K equal to 2 will be delta times, that is mental health flows. So similarly, other flows also will be K, 1, 2, 3, 4, etc. Right? All right. So then YI can be written as summation because the left-hand side should sum up to the right-hand side. So I can write YI as summation K YKI. So which I can write type BK times QKI, or in vector times capital QI times B, where QI is these variables and B transpose is basically these coefficients, right? So YKI equal to BK QKI represent the income flows from the variable K. For example, income flow for mental health by Y will equal to delta MHI. So the income flow of a variable can be positive or negative depending on the sign of the coefficient. Right. So basically, doing some manipulation. I can write this because I can write this using this. I can go here and finally I arrive at this, where VKI is basically the contribution of kth income flow to inequality. This when expressed in percentage terms, because total is when you divide by I. So this is called the decomposition rule. Right. So basically, this decomposition has to satisfy the negativity property. So the negative property will satisfy for generalized entropy index when the parameter C lies between 0 and 2. But for Gini and generalized entropy indices with C less than equal to 0 and C greater than equal to 2, they fail to satisfy this negativity property. So basically, this is for some general C. This looks like, so this is your weight. So this weight looks like this, and this C parameter is important. And so this mu is the mean income of the distribution. But the parameter C represents the different perception of inequality with lower values indicating higher inequality aversion. It assigns greater importance to income transfers at the lower end of the distribution and lesser importance to those at the upper end. So the choice of C allows like investigator to observe inequality changes based on the perception of inequality aversion.
And just one question, clarifying, in terms of the data you were showing us about the movement of the mean and the distribution, yes. And what about the change in inequality in the distribution? Did the mental health distribution you're looking at in your data become more unequal?
Yes, that's what, right? Because unequal in the sense that I showed the top 25%. So the worst mental health was 1% in 1.5% in 2001, and it became 19%.
But also the people who were 75 and above was 57 and became 45.
45. Right?
So it became half, right? Not necessarily. So I'm saying even the top didn't become. Inequality would increase when the top pulls away from the bottom.
No. It also depends on it's not only top. You have to look at the whole.
Yeah, that's what I was asking. When you look at it, so did you have a measure of inequality for your distribution? It increased.
Yeah, so I will decompose it. I'll decompose the inequality and I'll show you the decomposition. Okay. So again, this is the most well-known. This is when C equal to 1. So C equal to 1 also takes care of it, and this is the tile decomposition, famous tile, T1. So now inequality decomposition results. So okay. So because inequality, all these changes will happen, doesn't happen suddenly. So we are taking a 5 years gap, right? So now, look at now this table. So if you look at this table, so here mental health contributes 19%. So it contributes negative. That means mental health negatively contributes to inequality. So that means mental health improves, inequality comes down. So this is a negative contribution. Whereas this negative contribution is coming down over time. And this is why it is coming down over the time, exactly because I showed the distribution. Okay, right? So, but it's coming down, but still it is negative, right? So that means mental health contributes negatively to income inequality, right? And so, for example, people who are below 45 years also contribute to equalizing. Right? Graduate basically increase inequality. City people decrease inequality, right? So similarly, marriage de facto decrease inequality, right? And whereas the random, because you have the individual fixed effect and the random term, they both also increase inequality. So the important thing is look at the first, right? So here the mental health contributes. This is again in percentage terms, right? This is declining, but it is negative.
So sorry, do you have a sense of like what explains the results on this? Like
yes.
Is it more because the lower income households are because they're becoming more productive and so that reduces income inequality, or is it because more of the higher there's like a more limited marginal effect on the higher income individuals and so they don't increase their productivity or income too much?
So basically, I have So basically, here the role of mental health reducing inequalities is comprehensive given the elasticity of income concerning a 1-point enhancement in mental health is notably higher. So at the lower level of distribution, and a 1-point increase has more increase for. So that means if the same one point increase in mental health improves so mental health basically improve the income more for people at the lower end of the income distribution compared at the higher end of distribution. For example, the ETA estimates are 0.85, 0.64, 0.42, 0.32, and 0.25 at income levels 15,000, 20,000, 30,000, 50,000. So as you go, right, the elasticity declines, right? And so again, the idea, so coming to that, these unequal effects of income are plausible because enhancement in mental health elicit positive emotions like happiness, joy, and motivation, which hold greater significance for individuals with lower incomes who are likely to be judged based on their motivation and effort rather than skills like high income workers. All right. So usually people who are low income workers, they are going to be judged based on their motivation and skill. And that if you improve mental health, it will increase the income proportionately more compared to the higher, because higher and income people are judged by the skills, right? So basically, I think So again, now let me come to the marginal effect. So while informative, what is crucial in understanding how marginal shifts in mental health impact on inequality? This is because at any given moment or in the short term, public policy can only exert marginal influence on mental health. So from the public policy perspective, I think you need to look at the marginal effects. So imagine an external change in each individual's mental health by a small percentage E. So MH can be written as 1 plus E times MH. So if you do some jugglery, right? So you can get eta, elasticity of mental health with respect to income inequality. You get this, you get these formulas. And again, where SMHI is YMHI by YI and SMH UMH by B. right? And again, so now if you look at the table 4, which you can see, so what you can see is, so you have entropy elasticities for aversion parameter C equal to 1.1 and 1. So in the case, both gives you negative value. So in the case of, in 2001, C equal to 1.1, the entropy elasticity is minus 0.43, indicating that a 10% increase in mental health corresponds to 4.3% reduction in inequality, right? But again, in the following year, all entropy elasticity remain negative, but they drop in value, right? We speculate that shifts in the distribution of mental health and income over time have influenced this decrease in elasticity, but we cannot disentangle how much the mental health contributes, how much income contributes, because when you do the math, it is not decomposable, right? So, but they are responsible, but how much each is responsible, we don't know. Right. Okay. So again, so the real income of both males and females show consistent. So this is about male. So male and female, both incomes are rising over time, and although male income is more than female, but the difference is coming down. The gap is coming down. The gender gap is coming down in terms of income. Females show lower income disparity than males in 2001, 2005, and 2010, but reverse is true from 2015 to 2019. So again, the IV fixed effect model is separately estimated for females and males, and you see you can see later, but I'm going to just talk. So if you see the female coefficient turns out to be much less than male, both are statistically significant. So for female, it is 72.24. And male, it is 174. And overall, when I pooled the sample, it was 128, right? So this suggests improvement in mental health have more pronounced impact on male income, right? So again, important thing is in 2001, mental health contributes to 27% reduction in income inequality among females and a 15% among males. Again, that's the difference between males and females.
Sriram,
right?
can I ask a question about your age? Sorry, can you go back to the previous, like the age income profile? Have you tried different kind of profile instead of just using this piecewise?
Miss, if I use quadratic also, I get similar result. But only thing is that we wanted to follow the theoretical literature. So only thing is the cutoff maybe 1 year here or there, but it's not going to change. But we didn't want to follow a quadratic one because quadratic is symmetric. But in literature, people have shown the age and income profile is hump-like. It's not symmetric. So we have tried different, but in the results we have done is just hump-like. But even if I do age square, results are not going to be changed. Right? So again, okay. So across both genders, all entropy elasticities are negative, indicating enhancement in mental health elevates inequality in each of the gender categories. Notably, this effect is more pronounced among males than females. Specifically, in 2001, the inequality elasticity of mental health stands at 0.32 for females and minus 0.49 for males. These numbers suggest that a 10% improvement in mental health corresponds to a 3.2% reduction in inequality among females and 4.9% reduction among males. Over time, these effects of mental health diminish, right? So this is the result. So you can see 72 for female and 170 for male. And again, this is the top one is for female decomposition. This is minus 27.358%. This is minus 15.68%. And this is also declining over time. The same way for overall also it was declining over time. Right? So this is basically for C equal to aversion parameter equal to 1.1, and this is for C equal to 1. So these are consistent. Right? So basically this study investigates the impact of mental health on income and its implication for income inequality. The resulting income flows attributed to mental health and other variables are then integrated into an inequality decomposition equation to assess their individual contributions to the overall income inequality. The study examines how income inequality responds to marginal improvements in mental health, a novel aspect not previously explored in existing literature, as far as you know. So the results that emerged from this study are quite appealing. Mental health has positive and significant effect on income generation. The regression-based inequality decomposition reveals that income associated with mental health contributes to reduction of income inequality. The inequality reducing role of mental health is quite plausible because mental health improvements enhance positive emotions such as happiness, joy, and inspirations, which matter more for people at the low income than people at a high income, and for them skill matter more. So that is why improvements in mental health at lower level basically decreases inequality. That's the big picture. The elasticity of income inequality in response to changes in mental health is negative, suggesting that as mental health improves, income inequality decreases in a society. This inequality reducing effect of mental health is more significant among males than females. And these are the references. Yes. Yes.
Listen to me here, and you did not find this. I think maybe we can talk about more about you define about mental health in your study, because we know that it's so many different perspectives about mental health, but in your study I didn't hear. I have no idea what kind of perspective you are from. You mentioned joy, techniques of social support. I saw the you asked the point over 75 they have I have no idea on which perspective we should focus on. You say in your studies
the income.
mental health influences the income, but if we want to fix this, we have to know where and why, how to fix it.
Yeah, basically what I have done is the variable which I have used, it to some extent captures anxiety and anxiety or emotion. So this basically is something to do with mental situation, right? Anxiety, whether you're depressed or not, how anxious you are, so how your mood disorder. So this is the variable which captures. Of course, it's probably not going to how it captures because it's subjective. So there are you can dispute the subjective nature, but definitely an improvement of that is going to, like, especially the main point is people at the lower level of income, if their mental health increase, they will be more productive in their work compared to people at the higher income level. But at the higher income level, because you are not judged by how motivated you are, like you are not like mostly people are not going to be blue collar. Suppose you are blue collar, most likely you will have to be motivated what you're doing, and you'll be judged by like lot of motivation you show, and you can be lot of laborious work you can only do properly when you're mentally sound. All right. So this is basically, this is the intuition. This is the main intuition. All other things are just basically making it like, because we have to write something and we have to present it in a very logical manner. But the main gist of it is ultimately this mental health is related with the emotional stimulation of individuals. And that stimulation would make you at the lower end of distribution, that stimulation can make you more productive at what you do. But that does not matter so much for people who are, say, professionals or managers, because they are judged by the skills, whether they are motivated or not. And you will find a lot of managers, they probably are not themselves motivated or not, they will probably demotivate you sometimes, right? So, not always, but sometimes, okay? But again, so at the higher end skills matter most. At the lower end, and that is what, if you see that, if you look at the just elasticity, that also elasticity was decreasing, elasticity of mental health, inequality with respect to mental health, right? So for at low level, it's much higher. So 1 point or 1% increase in mental health for at a low level will have much higher impact in decreasing inequality at the high. So again, there is a lot of subjective element, and I don't disagree with you.
It's still very general.
No, but again, this is not only for me. Like, if you see, it's happiness studies and other things, right? How people can question, right? In happiness, suppose 1 to 10 you are measuring. How do I compare your 7 and my 5? Right? You may be a very optimistic person and you may put, say, 7. I may be a pessimistic person, but I may be as happy as you. I may say 5. Right? So, but again, right, but we are dealing with something because we are dealing with some real data. So what we can do best is based on data, what we can say. But all these caveats, we can mention what we write. Right, in the literature, it's well known, like in happiness studies and people publish in many journals. That does not mean you have to accept it, right? I also don't accept many of things, but at the end of the day, if we want to come with a policy, right, using not the best data, second best data is better than just writing some like hand-waving story, right? Put all the caveats, put all the limitations, like what you said, right? So I also mentioned the problems initial slides, right? So the response bias, attrition bias, etc., etc. So these are the problems, and if you take into account everything, we can't write anything.
There's one quick reaction on something you were mentioning about why we might see differences between low-skilled and high-skilled workers, right?
No.
You went around this explanation of, motivation matters for low-skilled workers. For me, the alternative story, which is equally important, I don't know if someone should write a paper on this, is at high skill, you have contracts. So I have a job contract. If I am going through an episode of poor mental health, I can take sick leave. That's paid sick leave, and so on. So I'm not fireable. I don't get fired immediately because I'm going through a period of mental slump. Whereas in low skill,
there's no option.
There's no option. So it seems like perhaps the type of contract is more important than.
Yeah, that's true. So
this comes into a negative messaging. Like for low skilled workers, we should improve their mental health so they continue employed and they continue to be productive and working, instead of improving their contract situation, because the contract situation also determines mental health as well as.
That is true. That is true. But again, this study is not telling to improve only for the people at the lower level. Improve mental health at the margin. You can improve for everybody. You can have policy no matter what. You can have policies in workplace. You can also, this also could be a policy where you have contracts to get minimum time for everybody, irrespective of what skill level they are. But you are right, at lower skill level, that option, paid holiday or paid sick leave, is not an option, right? And but since my main aim was the relation between mental health and equality, but my main aim was like the contract, which is more labor economic stuff that can be done. I can get the very. You're right, but that will also, to some extent, one can look at how to be looking at stuff. But how does it affect income inequality? We'll have to think a little bit more about it.
Thank you very much. We're already running out of time, so we're going to finish the seminar here. If you have more questions, we can just talk outside. You can ask whatever you want. And also, I mean, it's a great opportunity just to do some network. There is people here from very different universities and institutions, so feel free to get a coffee, talk to each other, and thanks a lot, and see you. Okay, and please give us your feedback by scanning the QR code. This is mandatory, so please right now. And thank you very much, and see you next week.